mentors and guests. Welcome to Leaders for Excellence and Public Service or LEAP Mayor's Fellowship Program. This program po is organized by Kaya Natin Movement for Good Governance and Ethical Leadership in partnership with San Miguel Corporation. As you all know, we have been doing LEAP since 2017 and now we are on our fourth run. So this is a new batch of newcomers. So for this year, we are doing a webinar series in order to prepare LGUs for the second year. And to welcome us, we would like to invite to the virtual stage our partner from San Miguel Corporation. Please welcome to share a few words for her welcome remarks, the Vice President of Corporate Affairs, Ms. Kinley Chow.
Hi everybody. Thank you for having me, Harvey, and everyone from Kaya Natin and LEAP and all our mayors. Some of the names are familiar, but it's been a while since I've seen you. So, hi, very nice to see you, even if just on Zoom. I don't know, what do I say? So, anyways, you know what? A couple of days ago, I was thinking, when I was very young, I used to wonder what it was like to live during a war, because my parents, when they were growing up, they would tell us about how they were growing up during the Japanese occupation. And I was thinking, napakaswerte talaga ng generation ko. We never sort of went through anything like that. And I used to wonder when I was a little older, what sort of challenges my generation would face. Never thinking, of course, that this would be it. Something like this. I think this is beyond any of our wildest imaginations, that we would end up in the middle of a pandemic that has brought our nation to its knees, and I think pretty much every economy around the world as well, no? But this is where we are, and it's really up to us as leaders, you as leaders, particularly in the local level, to help us rise to our feet. So maybe just a few words also of San Miguel's response. I mean, I think I'm not sure if you know of the scale of our response, but I think I have seen some of you are very familiar to me and have reached out to us during the last couple of months. And I hope that we've been able to help you. I'm so proud and so honored really to belong to an organization like San Miguel, whose leader, Mr. Ang, I think is the leader for our times, the leader that these times call for, particularly in terms of his ability to act fast, his ability to reach deep into his pocket to help other Filipinos, his steady hand of leadership, which I think all of us would really do well to emulate. When I saw in the title, it said something about the second wave, and I thought, okay, does that make it already sort of a default? Are we really headed to this second wave? I hope not. I mean, I'm still sort of staggered, you know, I'm still sort of recovering from what we've been going through these last couple of months, and I'm sure you have too. Because if I feel this way just on a company level, with all these resources to back us, I'm sure sa inyo, sobrang hirap talaga yung challenges na hinaharap nyo. But just to say thank you so much for the service that you've given your towns, your municipalities, your cities, your country. And just to say also that how you respond, how we each respond, is how we are going to be remembered in the future. So I guess andito na tayo, kailangan natin pagbutihin. And it's really in these kinds of venues that we can learn from one another and help solve our nation's problems. I've never met her. I understand our guest speaker is Usec Vergeire. I've never met her, but she's been amazing. And I just want to give her a public recognition for us from San Miguel and thank her for all the help that she's given us in setting up our own lab. I also want to thank her as a private citizen for her leadership to us during this time, for being so unflappable and for being a calming presence to the nation every time she goes out on our TV or on our computer screen, giving us some grim news every night, but also holding out the hope that better days are to come. So really, we don't know how this story is going to end, and I think it's going to be a few months before we know what shape we are in. But kailangan talaga sama-sama. That's our sama-sama sa laban. And from San Miguel, I can assure you that we're with you every step of the way, and we will do our best to help. Those are the marching orders of Mr. Ang. I think very, very early on, if we were in lockdown, 2 days later, uh, on the 17th, 2 days later, he called us all to his boardroom and he said, tulong tayo. Wherever you see there people need help, dun tayo. And we hope that we've been equal to his challenge. And I look forward to hearing what Usec has to say. And Usec, salamat talaga sa tulong nyo ng DOH. And you still have to visit our lab. I'm still going to hold you to that. And I hope to be able to welcome you there very soon. Thank you very much. And thank you, Harvey, for having me.
Thank you very much po, Miss Kin, for your message. Thank you as well po sa San Miguel Corporation for all your efforts in helping out different communities in this time of crisis. Now, for our topic for today, highly requested po ito ng ating Mayor Fellows when we asked them kung sino yung mga gusto nilang ma-meet for this webinar series. They really requested for a representative from the Department of Health. So now our topic will be important learnings on the relationship of LGUs and NGAs in the time of pandemic. And later on, we will be having a question and answer portion. So kung may mga katanungan na po kayo ngayon, you may do so by asking po sa ating chat box. I-type nyo lang po yung questions and we will read them later. So we will now formally introduce our guest speaker. Dr. Maria Rosario Vergeire is the current OIC Undersecretary for Health Regulation Team and the official spokesperson of the Department of Health Philippines. She was previously the Assistant Secretary in charge of the Public Health Services Team. She also acted as OIC Deputy Director General, Filed Regulatory Operation at the Food and Drug Administration, Office Director of the Health Facilities and Services Regulatory Bureau, and Chief of the Health Research Division of the Health Policy Development and Planning Bureau. Undersecretary Vergeire has committed decades to public service, having worked in Marikina City's health office before joining the Department of Health in 2007. Aside from public service, she is also committed to nurturing our soon-to-be public health leaders, serving as faculty at the Development Academy of the Philippines and part-time faculty in Ateneo School of Government. She obtained her undergraduate degree in zoology from the University of Santo Tomas, her MD from De La Salle University College of Medicine, and her master in public health from the University of the Philippines, Manila. Now, to discuss important learnings on the relationship of LGUs and NGAs in the time of pandemic, we are very honored to have here with us today. Let us all welcome Undersecretary Dr. Maria Rosario Vergeire.
Thank you, Winona. Good afternoon po sa lahat sa inyo. Magandang hapon and good afternoon to Kin. Ngayon lang din kita nakikita, no? This is the first time I'm seeing you, but thank you for the words na binitiwan mo, no? Salamat ng madami. And yes, I will go to your laboratory one of these days. Hahanap lang tayo ng oras, no? Dahil talagang marami tayong ginagawa. But I will commit to that. And good afternoon po sa ating mga local officials na naandito ngayon. Ngayon pong araw na ito ay magbibigay lang tayo ng kaunting impormasyon tungkol po sa mga ginagawa ng Department of Health together with our local government units. Before I start my presentation, I would like to recognize the efforts of our local government units. Alam po namin kung wala po kayo, hindi po magiging posible itong response na ginagawa natin dito. And alam po namin at gusto kong ibigay sa inyo yung impormasyon na kayo po ang pinaka-importante na sangay na gumagawa ngayon ng mga response natin dito po sa pandemyang ito. So we like to you for all the efforts, and we would like to recognize your efforts. At lagi niyo pong iisipin, katulong niyo po kami dito po sa response na ginagawa natin ngayon. So this presentation, I will provide updates on the nation's response against COVID-19, how DOH advanced from its small wins towards responding to the gaps of this response. I will be presenting afterwards the code strategy, coordinated operations to defeat the epidemic, where the DOH together with the IATF and the National Task Force has developed incorporating the important learning on the relationship of the local government units with the national government agencies that would allow to effectively respond to this COVID-19. Next slide, please. So this next slide will just show you, all of you, our case summary. No? So this is as of August 7, that is yesterday. We have a total of 53,734 active cases. So pag sinabi po nating active cases, ito po yung nasa mga listahan natin dito po sa ating talaan kung saan sila po yung mga inaalagaan pa rin natin sa ngayon. So we have tried to revise kung paano po kami mag-report. If in the past, we were reporting always the total number of cases. But marami po ang nagsasabi no, na parang hindi nagbabago at pataas ng pataas. Hindi natin ma-monitor, hindi natin ma-analyze ng maayos because total cases, eventually, alam po natin lahat, talagang araw-araw tataas yan. But for the active cases, we will be seeing, no, pag bumaba na po yung trends natin, mababawasan na rin po siya. That's why we are now focusing on the active cases. And then we have recoveries of about 66,852, which comprises about 52 to 53% na recovery rate tayo sa ngayon. So I think that was last week of June, nung nakapag-impute po tayo ng maraming mga figures kung saan tumaas po ang ating recovery rate up to 72%. But now that the cases are increasing, recoveries, siyempre po, ito po ay kabuuan at hati-hati. These total cases would comprise all the active cases, recoveries, and deaths. So ngayon po, nasa 52% tayo, and deaths are at 2,168. Our case fatality rate as of this time that we speak is about 1.8%. Next slide, please. So, pinapakita lang ho natin dito sa slide na ito ang ating journey sa ating laboratories. No? So, if you would see, we started off with just one laboratory noong February, nung nag-umpisa po tayo ng response natin. At kung matatandaan nyo po, pinapadala pa ho natin sa Australia ang ating mga specimens para magkaroon tayo ng confirmatory results. But from a laboratory, sole laboratory in February, we now have a total of 100 laboratories, 76 PCR laboratories, and 24 gene expert laboratories. You would see our journey that when we started off with June, talagang dire-diretso na po ang pagtaas ng ating mga lisensyadong laboratorio at ito po ay nakadistribute across the different parts of the country. We only have now Caraga, na wala pa pong laboratorio, pero po yung kanilang laboratorio ay malapit na rin pong malisensyahan. So once it is licensed, lahat na po ng regions natin ay magkakaroon na nitong lisensyadong laboratorio. Next slide. And just for the information of everybody, I know that you have been able to read the article yesterday where it was reported that Philippines has the highest testing capacity across Southeast Asia. So tayo po ay nagkaroon po tayo ng ngayon po nakakapag-test na tayo ng almost 1.6 million individuals here in the country. Much more than the other countries in the Southeast Asia. Meron na po tayong capacity to test around 28,000 tests per day na napakalaki na po ng agwat natin sa ibang bansa. Comparing it with Indonesia, Indonesia only have tested around I think 900,000 of their population is only able to test 14,000 tests per day. So makikita ho natin that we really have gained grounds when it comes to testing. kailangan lang ho nating pag-igtingin at saka kailangan i-link natin doon sa iba pa hong components ng ating response. Hindi po pwedeng nagte-test lang po tayo, kailangan immediate isolation for all of those people identified to have symptoms or for those people who are exposed to a positive individual. So ito pong slide na ito, ipapakita lang natin kung gaano na po kadami no, yung ating laboratorio. Sabi ko nga, 100 na po ang ating laboratory and there are around 74 laboratories on stages 3 and 4 of our licensing process. Ibig sabihin po, malapit na rin po silang malisensyahan. Hopefully, in the coming 2 months, ito pong 74 na ito ay malisensyahan natin lahat para po mas dumami at mas magkaroon tayo ng equal distribution of these laboratories across the whole country. So as I've said, it is only Caraga na wala pa hong laboratorio ngayon, pero their laboratories are now on stages 3 and 4 at malapit na po natin silang malisensyahan. Next slide, please. As I've said a while ago, we have this testing capacity which is really increasing, no? So pag tinignan ho natin itong ating mga daily outputs starting June, we will see really the increase in the number of tests that we can do per day. So this shows the number of daily tests conducted and the 7-day moving average for the past 60 days. From a mere 1,200 per day by the end of March to an average of more than 10,000 daily tests in early June, and now to almost 30,000 tests conducted daily. We have tested more than 1.5 million people already with a cumulative positivity rate of 9.78%. Next slide, please. So ito pong susunod na slide, we just like to show you our capacity for our health systems. When we talk about health system capacity, we measure it through our hospital beds, our ICU beds, our mechanical ventilators, and of course, our ward beds. So pag tinignan ho natin, medyo nandun tayo sa danger zone because nasa 54% po ang occupied for ICU beds, 53% for ward beds, and 50% for isolation beds. But if you would notice, mechanical ventilators utilization is quite low kasi po ngayon ang ating mas ginagamit na ng ating mga clinicians yung mga high flow na mga oxygen and seldom is mechanical ventilator being used in the hospitals already. If we will try to disaggregate po itong ating health system capacity, makikita po natin na sa ibang lugar po, dito po sa ating bansa, no, makakakita po tayo na meron pong mga pagtaas talaga ng paggamit nitong mga beds, especially in National Capital Region, in Region 7, and in next slide. The next slide would show us our capacity to isolate. No? So sabi ko nga po kanina, can we have the next slide? Yes. Sabi ko nga po kanina, ang pinaka-importante po sa response natin ngayon is really isolation. Napaka-importante po kasi pag inisip po natin, even though you do not have any test done, basta i-isolate mo lang ang pasyente, mako-contain mo na ang transmission. Because sometimes, marami po sa atin, inaantay pa yung resulta ng test, no, bago natin i-isolate ang pasyente. Hindi po dapat yon. Ang dapat po, mauna po ang isolation, i-test natin sila kung meron tayong access to testing, and then kapag na-test, saka po natin mas mamamanage. Pero really, what would be most important is immediate isolation of a patient who has symptoms, and also those individuals who were exposed to a patient with symptoms or to a patient confirmed with COVID-19. So makikita po sa slide na ito na nag-umpisa rin po tayo sa iisa lang quarantine facility dito sa ating bansa. And that was dun po sa Clark. Yun po yung pinaglagyan natin or pinag-admitan natin ng mga OFWs na umuwi. Nung unang-una pa po tayo nagpa-uwi ng ating mga OFWs. So ito po ay isang quarantine facility lang nung nauna tayo. Pero ngayon, we have more than 9,600 ligtas COVID facilities or the temporary treatment and monitoring facilities with more than 88,000 bed capacity. And also, aside from that, we also have 14 mega temporary treatment and monitoring facilities. Ito po yung malalaking quarantine facilities dito po sa Metro Manila kung saan meron po tayong 3,141 bed capacity. Not only that, because we are now strengthening our efforts to isolate individuals, especially those doing home quarantine which cannot comply with the conditions para po mag-home quarantine. Nagdagdag na po tayo ng mga beds, no, at mga quarantine facility, and we even have contracted already different hotels in Metro Manila para po maging quarantine facilities nitong mga individuals that cannot comply with home quarantine. Next slide. So the next slide would show you our health human resources for health. We all know that we are really challenged when it comes to health human resources for health augmentation. Alam po natin, especially in our hospitals, no, ito po talaga ay medyo nagkakaroon tayo ng challenge because our healthcare workers in our hospitals, napapagod na po sila, yung iba po naka-quarantine, so they need augmentation for this HRH. So ang ginawa po natin these past days, we were able to seek the support of the other regions where magpapahiram na po sila ng kanilang mga cadre. Dadali na rin po dito sa National Capital Region para ma-supplement po natin ang ating health human resources for health in our hospitals in the National Capital Region. This slide would show you how we have augmented our health human resources for health since the start of this epidemic or pandemic. For the priority health facilities like hospitals, the other facilities, we have 368 post-residency deployed physicians. We have nurses deployment program redeployment, 1,379. And we were able to hire already 6,781 health human resources for health. As to the COVID response activities like contact tracers and swabbers, we already have 8,966 nurses deployed, nurses deployment program nurses, no? So sila po yung tumutulong swab sa pagpo-contact trace. We also have our public health associates. Sila po yung hinire namin dati para mag-analyze ng data, but are now being used to help in the contact tracing and swabbing. And we have a total of 3,893. With all of this, we were able to be provided with sub-allotted funds of around 1.2 billion pesos para po ito sa pag-hire ng ating additional health human resources for health. Galing po ito sa Bayanihan Fund. And ngayon po, ang natitira na lang, I guess, para pong as far as I recall, it's about 100 plus million na lang po ang natitira. Kaya humihingi na po tayo ng karagdagan sa national government, no, para po tayo ay magkaroon ng additional funds at makapag-hire pa ng mga kinakailangan nating healthcare workers. Next slide, please. Now we go to the coordinated operations to defeat the epidemic, or the CODE strategy, and we have created the COVID-19 CODE team. The DOH recognizes that despite the wins in our earlier response against COVID, there are challenges that come along the way. We realize that the national strategies needs to be better accustomed at the local level, at the barangay level as much as possible. Also, the cascade of information from the national to the local level has not been very dynamic, leading to meager awareness and poor compliance to minimum health standards. Despite avenues like this webinar and other telecom meetings, coordination between the local and the national levels needs to be strengthened further to ensure that we are all harmonized in what we do. These challenges have been our lessons learned as we advance towards a more responsive strategy, which is the CODE, or the Coordinated Operations to Defeat Pandemic. In clinical practice, as we all know, CODE teams are specialized teams who saves lives in hospitals. This is a multidisciplinary team of health workers alerted to begin immediate resuscitative efforts for patients under cardiopulmonary arrest. So ito pong mga CODE team, pag nasa ospital po tayo, pag na-arrest po sa ospital, sila po yung immediately ay rumiresponde para maibiyang buhay, no, yung pasyente na nag-aagaw buhay. The concept of CODE team aims to bring back the health-focused, driven approach in responding to epidemics, in particular COVID-19. So the same system can be used for other outbreaks. So, bakit po ba itong initiative ay ginagawa po natin? Ano? So, we like to operationalize the national government-enabled and local government-led, people-centered response with health taking primacy in the approach. Lagi po nating binibigkas at sinasabi ito sa lahat ng telecon meetings natin na dapat national government-enabled, local government-led. And we recognize po, no, nakikita naman natin that really the local government officials are leading our response. But we need more. We need to strengthen it more para po mas maging successful tayo. We like to provide stronger support to our local governments who need it the most. No? So ngayon po, minapa natin lahat po ng mga kaso sa bawat lugar dito sa ating country, and we have identified priority area. So we are going to prioritize pang tutulong po natin this food team with the higher number of cases na mga areas, with those with clusters of infection and those with fewer resources available, like wala po silang mga masyadong health human resources health, kulang po ang testing centers nila. So bakit ngayon po natin to ginagawa? Because we need more efficient ways for lockdown or localized lockdowns to work so that we don't go back to ECQ. So nakita ho natin dito po sa atin sa Metro Manila na balik po tayo sa modified ECQ, no? And we do not like to go back to this state again. Kaya nga po, ang gusto natin, mas strengthen ng local government ang mga localized lockdowns. When we do our localized lockdowns, hindi lang po natin isinasara yung area na yon. Kailangan, pag sinara po natin, we do intensive contact tracing, intensive isolation, identification of individuals who are symptomatic. So, in effect, we will be doing active case finding, meaning systematic screening and clinical evaluation of patients in the community. Hindi na po natin aantayin ang pasyente na lumapit sa atin. Sila na po ay hahanapin natin isa-isa. We are adopting the Ravi model. Ito po yung sinasabi, no, for these past weeks already. Ito po yung experience ng Mumbai, kung saan ito po ay isang lugar na nagkaroon po sila ng house to house, no? Pinatok nila ang bawat bahay, in-identify po nila kung sino ang may simptomas, in-identify po nila kung sino yung mga exposed sa mga positive individuals, at sila po ay nilagay sa mga quarantine facilities. So this is the one of the activities that we will be doing under this food strategy. We like to eliminate clusters. Alam niyo po, we have identified a total of about 700 plus clusters, no, dito po sa ating bansa sa pagtaas ng mga kaso na ito. And out of these 700 plus clusters, around 500 plus are coming from the communities. Ibig sabihin, community clusters. Kaya po pinag-iigting natin ang ganitong strategiya para po sa ganon ay tayo po ay makapag-contain ng transmission nitong sakit na ito. Next slide, please. So, ang dami pong nagtatanong, nagawa na po ba ito dati? Yes, nagawa na po natin ito dati. Kung matatandaan po ng mga lugar na nakasama natin, ano, nung nagkaroon po tayo ng DOH sa Bayang Patak kontra Polio nung isang taon, ito po yung ginawa natin. No? So, nagkaroon tayo ng strong engagement with our leaders, community members, and healthcare professionals in the area. Nung nagsabayang patak kontra polio po tayo nung isang taon, hinikayat po natin, ano, even local officials were helping us, even the local stakeholders, yun pong mga civil society dun sa locality na yon, yun pong mga professional organizations, tumulong po sila lahat sa atin, kaya tayo po ay nagkaroon ng mataas na accomplishment for this kontra polio. Ganun din po ang ginagawa natin ngayon. Ano? We are trying to engage ito pong ating community para makatulong dito sa gagawin natin mga hakbang. Gagawin po natin itong needs-based augmentation of local resources by the national government and other development partners kung may mga kailangan. And of course, this is a multi-agency, multi-stakeholder support from our educators and our uniformed personnel, among others. Next slide. So ano po ba ang mga responsibilidad ng ating food team? Unang-una, we need to assess our high-risk communities for compliance to protocols. Marami ho ang kailangan nating pag-isipan, ano, when we try to analyze our locality. Pero unang-una na kailangan natin makita, nagko-comply ba talaga sa protocol itong locality na ito? Unang-una, are they complying with the preventive measures? So what are the preventive measures? These are the minimum health standards. So kailangan yung locality o yung LGU nasisiguro niya na lahat ng tao sa kanilang lugar nakamask paglalabas ng bahay. Lahat ng tao sa kanilang lugar nagpi-physical distancing. Lahat ng tao sa kanilang lugar alam na dapat laging mag-ugas ng kamay kapag nakakahawak ng mga commonly touched objects. At saka, bawal ang mass gathering. So lahat po ng ito are preventive measures and this has to be enforced by the local government. Second, kailangan po natin mag-trace. No? So ang local government pa na yun, nag-localize lockdown, nag-trace ba sila? Nagbabahay-bahay ba sila? Nakikita ba nila yung mga dapat nilang makita na naging exposed doon sa taong naging positive o nagka-simptomas no, of nitong COVID-19? Kailangan din kapag na-trace nila, ma-isolate nila agad. Meron po bang isolation facility doon sa kanilang LGU? Ito po bang mga tao sa LGU, pinapayagan natin mag-home quarantine? Tandaan po natin, ang home quarantine, may protocol tayo dyan. Kapag meron kang sariling kwarto mo, meron kang sariling banyo mo, wala kang vulnerable population dyan sa bahay nyo, at ikaw ay mamomonitor ng iyong Barangay Health Emergency Response Team, papayagan kang mag-home quarantine. Pero kung wala ka at hindi ka makaka-comply sa mga condition na ito, dapat ang individual na yan ilalagay natin sa quarantine facility. Kaya napaka-importante po ng mga ligtas COVID centers ng ating mga local governments. Kasi dito po natin i-admit ang mga taong may mild at saka asymptomatic na wala po silang kakayanan na gawin ang home quarantine. And of course, pag na-isolate po natin, iti-test po natin sila. And kung sakali ang magpo-progress ang kanilang simptomas, dapat may referral din po tayo. Galing sa ligtas COVID centers nyo, you need to have a hospital where you can refer the patient kung magpo-progress po ang simptomas niya. And then after, no, ito po napaka-importante at may bago na ho tayong protocol. Sinabi po ng protocol natin, kapag ang isang pasyente positibo, mild, asymptomatic, kapag asymptomatic siya nag-umpisa, hindi po siya nagkaroon ng simptomas no, for the period ng 14 days na naka-isolate siya, after the 14th day, pwede na ho siyang itag as recovered. Kailangan lang hong i-clear ng ating mga doktor, pwedeng municipal health officer, city health officer, or provincial health officer, pwede na ho silang itag as recovered. Kapag mild naman po yung case, kapag nag-resolve na po yung symptoms niya, and then siya po ay nakita na ng doktor at sinabing clinically recovered na siya, pwede na po siyang pauwiin, mag-isolate hanggang makatapos ng 14 days lang. So that is from the onset of illness, magbibilang lang po ng 14 na araw. So ibig sabihin, for example, ang isang pasyente po, nilagay natin sa quarantine facility. May simptomas po siya, halimbawa, na ubo. Pagdating po ng ikapitong araw, siya po ay nawalan ng ubo at sinabi ng doktor, clinically recovered na siya, he's okay already. Kailangan na lang po itong pasyenteng ito, tapusin niya yung additional na 7 days kasi nakapitong araw na po siya ng isolation, another 7 days to complete 14 days. Pagkatapos po ng 14 days, based on the assessment of the municipal health officer, city health officer, or the provincial health officer, pwede na ho siyang itag as recovered. So marami po kasi nagkakaroon ng misinterpretation sa ating protocol na ito. Marami pong local government units hanggang sa ngayon, gusto pa rin nila, itetest pa rin nila yung mga tao na nakakatapos ng quarantine o kaya lumalabas ng ospital. Ang protocol pa namin sinasabi, hindi na kailangan ng test. Tandaan po natin, nababalitaan po natin, marami pong mga individuals na positive po sila, tapos pagkatapos nila mag 14 days, magaling na sila, positive pa rin sila. Yung iba, 2 buwan na, positive pa rin sila. Kasi po, ang RT-PCR po na test ay napaka-sensitive. Kahit po mga remnants lang ng virus yung nasa katawan ng tao at hindi na po siya, wala na po siyang sakit, nadidetect pa rin po niya. So ang nangyayari po, paulit-ulit lang tayo ng pagka-test, nasasayang po yung ating resources for that. When in fact, the experts already have said, on the 10th day of illness ng isang taong may mild or asymptomatic, non-infectious na po siya. kailangan lang tapusin yung 14 na araw para makasigurado tayo. Pag tinignan ho natin ang experiences from other countries, ang USCDC po, pang 10 araw, dinidischarge na nila yung pasyente, tinatag na nila as recovered. Doon po sa ibang bansa naman, sila po ay nagkakaroon ng hanggang 14 na araw, parang pong dito sa Pilipinas. Sa ibang bansa, nagdadagdag po sila ng additional 7 days kasi may resurgence of cases sila like in Vietnam. Pero dito po sa atin, lahat po ng bansang yan, USCDC, yun pong European CDC, Vietnam, I think in India, hindi na po sila nagre-require ng repeat test pagkatapos ng 14 na araw ng pasyente. Ang kailangan lang, meron ho siyang criteria na clinically recovered based on the assessment of the doctor at nakatapos ng 14 days isolation. And then the patient can already be tagged as recovered. So sana po masusunod natin itong protocol na ito para naman po hindi nakakaawa din yung mga pasyente natin na minsan isang buwan na pong nasa quarantine facility, hindi po natin sila mapauwi kahit na wala na silang simptomas kasi yung kanilang RT-PCR na test, paulit-ulit, positive pa rin ng positive kahit magaling na sila. Lagi po natin tatandaan ng RT-PCR po, hindi niya sasabihin sa iyo kung infectious ang pasyente. Sasabihin lang niya sa iyo kung positive ka sa virus o negative ka sa virus. So based on the expert's recommendation, we don't need to do repeat tests. We can tag patients as recovered as long as they were classified as clinically recovered and have completed 14-day isolation. Next would be to mobilize community and stakeholders for action planning. Ngayon po, we will be more inclusive. Bababa po yung mga teams natin, makikipagplano with the local governments para po kung sa ganon ay alam po ng LGU natin kung ano ang kailangan nilang gawin. We will be complementing the community's resources and we will implement the plan alongside with the community. And of course, we will monitor results strictly. Next slide, please. So what does this code strategy entail? The code team will be mobilized on the ground to ensure seamless integration of our COVID-19 response. Dati po kasi medyo fragmented, Yung ibang LGUs, ang ginagawa, detect through testing, tapos mag-isolate, pero yung contact tracing naman po mababa, Minsan, tinignan ho namin ang datos ng contact tracing at makikita ho natin na nag-a-average lang po ang LGUs natin ng mga 4 hanggang 5 na nako-contact trace sa mga exposed individuals sa positive case. Na ito po ay napakababa kumpara dun sa sinasabi ni Mayor Magalong. Yun pong si Mayor Magalong, siya po yung mayor ng Baguio City, naging successful po sila sa pagpo-contain ng transmission sa kanilang lugar dahil po napaka-effective ng kanilang contact tracing efforts. Nagkaroon po ng parang target number si Mayor Magalong doon sa Baguio City. Sabi niya, naging successful sila kasi nag-average sila ng around 37 contacts traced for every individual identified with symptoms or for every confirmed individual. So ganun po kadami ang nakocontact trace nila within 3 days. Immediate po iyon. At na-isolate nila agad. Kaya na-contain nila yung transmission. So we are now adopting the strategy of Mayor Magalong. Of course, yung 37, baka hindi natin lahat kaya. Kaya sabi namin, 10 to 20 will do. Kung depende po sa pagkaka-expose ng mga individuals sa lugar. Napaka-importante rin kapag na-trace na natin sila, i-isolate na rin immediately. Kaya pag nakita ho natin, dapat integrated po lahat po itong ating components nitong ating mga ginagawa para po maging successful tayo. So under the PREVENT po, alam po natin, the IATF through the Department of Health will provide BIDA solution sa COVID-19 campaign materials to our community. BIDA solution is a behavior change recommendatory campaign that will keep reminding our people of the key preventive behaviors and minimum health standards. Minsan nakakalimutan kasi ng ating mga kababayan, kasi nga parang kailangan mag-change tayo ng behavior. Nakakalimutan pag nakita yung kumare sa kanto, tatanggalin yung mask, komportable na kasi sila, magkwekwentuhan na po sila, walang physical distancing. Kailangan lagi natin pinapaalala. That's why we are going to give BIDA solution materials so that people will always be reminded of these minimum health standards. With trace, Mayor Benjamin Magalong of Baguio City has shared his best practices no in conducting contact tracing in the community. So itong team will ensure that these best practices will be implemented in the community, no? Itong code team. The third will be isolation or quarantine. The National Task Force through our DPWH Secretary Mark Villar will ensure that all suspects, all probable and confirmed cases will be accommodated in our isolation facilities. And then under the test, the T3 through Secretary Vince Dizon will ensure that the expanded testing strategies will be implemented and followed. So alam naman po natin, nag-expand na po tayo ng protocol for testing kung saan po ang ibang mga grupo no kahit walang simptomas ay pwede na pong i-test. Katulad po ng mga cashier sa bangko, katulad po ng mga security guard, katulad po ng ating mga barangay health workers, katulad po ng mga vendors. So lahat po yan nandun na ho sa protocol natin na nakasama na sa ating expanded testing protocol. And then finally, for treat, we have the DOH through our Undersecretary Bong Vega, who provides overall guidance in having this one hospital command system to ensure po that hospitals are COVID-19 and non-COVID-19 prepared and ready. So nag-launch na po kami nitong One Hospital Command. This is a strengthened referral network between and among public and private hospitals in a given area. So meron pong incident command dito kung saan kung kailangan ng pasyente na ma-admit at walang pag-admitan dun sa specific hospital na pinuntahan, kailangan hong tumawag sa incident command system at yung incident command ang maghahanap ng ospital. Kasama din po dito yung mga transport system kung saan ang pasyente ay susunduin from one hospital to the hospital where he will be admitted. So in all of these stages, the DSWD through Secretary Rolando Bautista shall continuously provide social amelioration program and support to the community. So next slide, please. So this is a whole of nation approach and each stakeholder shall have a clear delineation of roles in this new strategy. So medyo magulo po yung slide, ang dami nakalagay. Pero kailangan lang ho nating isipin no, kung ano yung role natin dito sa gagawin natin na strategiya na ito. So we had been in close coordination with various stakeholders, not just from the national agency, but the local government units, the local civil society organizations, other non-government organizations, to develop a plan and respond appropriately and effectively to the needs of the local governments. So the DOH recognizes that each local government has its characteristics and features. Hence, it is important that at each level and each agency, dapat po may action plan na unique. Dahil alam po naman natin, hindi pare-pareho ang bawat local government po natin. Ang Department of National Defense, ang DTI, ang DILG at DOLE will be responsible in ensuring the engineering controls are observed in the community under the lockdown. So para po maging systematic ang approach natin, dapat po we will all undertake this. No? So for prevent, our PIAs and our HEPOs will put up Be the Solution campaign materials in the community as a reminder of the preventive behaviors that should be observed in the communities. Along with this, we will be disseminating face masks, face shields, and hygiene kits to those who are in need. So, ang target po ng ating presidente ay yung mga indigents natin, bibigyan po ng mga face mask, ng mga face shield, at saka mga hygiene kits. For DTEC, with the help of the Tracing Czar, Mayor Magalong, and DILG, local governments will conduct house-to-house case finding and other intensive contact tracing activities to ensure that all members of the community are covered and will be able to trace who are symptomatic from those who are not. So inumpisahan na ho natin ito last week kung saan pumunta po tayo sa mga piling mga priority barangays dito po sa Metro Manila. Nagbahay-bahay na po, nag-active case finding at nailagay na po natin sa mga isolation facilities yung mga taong hindi kayang mag-home quarantine. So for isolate, the isolation and quarantine czar, Secretary Villar, will assist the local government units in transferring the close contacts to appropriate facilities where their health and medical needs will be appropriately addressed and properly monitored. So marami na pong local governments na nakikipag-ugnayan sa ating DPWH para po matulungan sila na maisaayos po yung kanilang mga quarantine facilities. For testing czar, SecDizon will continue to ensure that all those who shall be tested will be tested and that results should be released soon para po magkaroon po tayo ng supplemento sa contact tracing efforts natin. And lastly, for treat, si Undersecretary Vega or a treatment czar will ensure that all patients with severe and critical conditions will be admitted in our hospitals and will be given appropriate treatment under the One Hospital Command System. In all of these stages, as I've said a while ago, DSWD will continue to provide family food packs, day-to-day commodities, and other amelioration support for the community. And these stages, there needs to be ownership of each unit on their assigned roles. So kaya nga po gusto natin magplano with the local governments para alam po natin no, na talagang i-own nila itong strategy na ito at magkakatulong-tulungan po tayo at magiging harmonized po ang ating actions. Next slide, please. So this slide would be my last slide. So as we forge ahead the code strategy, we call on everybody to be the solution. It is a significant behavioral change in all areas of our life that will keep us and our loved ones safe. The virus will be here for a long time while organizations are still working on a vaccine. In the meantime, each one of us can observe the minimum health requirements as part of our lifestyle. These are small acts of kindness that may have a big impact on preventing COVID-19. This can reduce your chances of being infected as much as 99%. And more importantly, this will reduce overall caseload. So sinabi na po dun sa isang study na ginawa po ng mga local researchers natin, kapag ikaw ay nagsuot ng mask, you reduce your chances of being infected by around 60 to 80%. Pero kapag ikaw ay nakamask at saka naka-face shield, tumataas po sa 99%, no? And when you do physical distancing. So ito pong tatlong ito, pag pinagsama-sama ng isang tao, this will reduce his chances of being infected by 99%. We know that many Filipinos have been complying with these guidelines and we thank all of you. So let us use this opportunity to spread the message further so that we can save more lives. So mas maganda po na ipapakalap natin ito sa ating mga community. We are also calling on all of you, our local chief executives, to reinforce our efforts at the barangay level. It is all hands on deck if we are to address this at the soonest possible time. So baka po pwede, we can partner and adopt our barangays already so that we can be able to enforce these protocols para po mas madali natin makontain ang infection. So let us just continue to spread the word and help those who may not be as informed as us and as motivated as us. Marami pa rin ho talagang mga kababayan natin na talagang kailangan pa ng konting push, no, para lang po mag-comply sa mga standards natin. So that way, kung magagawa po natin ito at magtutulong-tulong tayo, we can somehow reduce the clusters of infection that we have currently in the country. So ito lang po ang aking presentation ngayon. Maraming salamat po.
Thank you very much po, Usec Vergeire, for that very comprehensive report on our health situation. Salamat din po for addressing some of the concerns of our mayors. But before we proceed with the open forum, we would like to call on the lead convener of Kaya Natin movement for his message of gratitude. Please welcome Mr. Harvey.
Good afternoon po, Usec Vergeire, Kin Lichauco, our partner from San Miguel Corporation, and of course to our mayors, good afternoon. I'd like to personally thank, of course, on behalf of Kaya Natin movement, the organizers of this event, Usec Vergeire, for making time. I was also very excited to meet her in person, kahit na dito lang sa Zoom, because I really admire her for her, well, everything, no? For her courage, for her stamina, for her very calm disposition in this pandemic. I always look forward to hearing her briefings. So kahit gaano karami yung cases, para hindi nagbabago yung kanyang demeanor. So if it's 100 cases, it's the same. If it's 2,000 cases, it's the same. And I think that's the kind of leader that we need right now. Someone who is calm, someone who is calculated with the decisions that they make. And I'm very happy that we have someone like her in the DOH right now. Also, I'm very confident that if the DOH, the IATF, and our local chief executives together with the private sector work together, I think we can get through this. No? I'm very confident that the Filipino people are very resilient. Hindi naman talaga tayo pasaway, hindi rin tayo matigas ang ulo. Susunod naman yan eh. We just need to properly educate our constituents. And to all the mayors here, kasi lahat naman kayo mga mayor, your leadership is very important in the local level. Kasi alam naman natin na sabi nga ni Usec kanina, this is going to be a local government-led approach. All of us, private sector, sa national government, we will all support, we will all do our share. But the LGUs, you play a very important and vital role here. That's why mayors, I'm sure pa nagtulong-tulungan tayo, kakayanin natin yung COVID-19. I am hoping and praying that the MECQ that is happening right now in Metro Manila and other nearby provinces will work to flatten the curve. And hopefully, that will give us time to be able to assess and do the necessary protocols that have been advised by the DOH already. At the end of the day, I think tama si Usec kanina, yung first frontliner is us, yung households natin. If we are able to properly educate our people on what are the things that needs to be done, wearing face masks, wearing face shields, observing proper physical distancing, always washing your hands, or kung wala, using alcohol to sanitize your hands, then I am sure we can all work together to, again, flatten the curve and win this war against COVID-19. Positive ako na mananalo tayo dito. Pwedeng number 1 tayo sa Southeast Asia ngayon, but hopefully in the next few months, we will also become a country natin. So again, thank you so much, Usec, for making the time. Thank you so much for the very informative session. And I'm sure our mayors have a lot of questions para sa'yo. So sana we hope that you'll be able to address some of their issues and some of their questions as well. So thank you again, Usec Vergeire. Thank you again, Kin, for all the support that San Miguel has given. So Winona, we can now go on to the Q&A.
Thank you so much po, Sir Harvey, for your message. Now, para po mas ma-manage natin ang mga questions and of course, ang ating oras, we would like to request our Mayor Fellows na if you have questions, kindly type na lang po sa ating chat box and we will be reading your questions. You may start sending now. She's from Tabaco Albay. Ang question niya po ay, can you tell us more about the protocols in house-to-house case finding?
Yes, ma'am. Good afternoon po, Mayor.
Good
Thank you for that
afternoon,
question. I think
ma'am.
Gandang hapon po, Mayor. Yun pong gagawin po natin sa house-to-house, no? It's just like what we did for the Sabayang Patak kontra polio dati, no? It's just very simple kung saan yung code teams po natin na buuin, tayo po ay magbabahay-bahay. Pagpunta ho sa mga bahay po natin, tayo ay makikipanayam sa bawat pamilya, sino ba ang may simptomas, sino ang nagka-simptomas for the past days, sino po ang na-expose, at yung po bang bahay ay conducive para magkaroon ng parang home quarantine ang mga tao. So ito lang po yung mga titignan. It's just like we're tracing contacts. Pero this time, we are going to actively look dun po sa mga pwede o posible na mga kaso dito sa mga lugar. Alam niyo po, Mayor, marami po kaming experiences ngayon na ang mga tao, natatakot po sila na magdeklara sa kanilang barangay na sila po ay may simptomas o di kaya sila po ay na-expose dahil minsan po parang nagkakaroon ng stigma dun sa community at parang nagkakaroon po sila ng nilalayuan sila ng mga kapitbahay, pinag-uusapan. So parang nagkakaroon po sila ng fear and nagkakaroon sila ng ganitong hesitancy para magsabi sa atin kung sila ay may simptomas o wala. So sa ganitong paraan, nagagawa tayo ng house to house, makikita na huit natin itong mga taong maaring hindi pa rin ho natin nakita before, and we will be able to isolate them immediately para po makontrol natin ang infections.
Thank you po, Usec. For our second question from Mayor Jasmine Bautista of Magallanes, Cavite, is there someone or an agency or a task force who will be in charge of the RT-PCR testing? Where can we ask for help?
Ay RT-PCR po na kasama sa code. Ang bawat tao po, meron ho tayong protocol na ginawa. Yun pong mga ma-identify natin na mga may simptomas, pag ginawa natin itong active case finding, isa-swab na po yan. So dapat yung code team, isang buo na po yan. Meron tayong swabbers, meron tayong contact tracers, meron po tayong mga taga-tala ng mga datos. No? So kapag umikot na tayo at nagbahay-bahay, pag naka-identify na ho tayo ng mga may simptomas, immediately sa swab na po natin sila. Ngayon, kung ano po yung pinakamalapit na mga swabbing or testing facilities dun sa area nyo, dun po natin ipapadala yung swab na yan. At ito naman po, bawat Pilipino naman ay miyembro ng PhilHealth, no? And PhilHealth covers for this testing na ginagawa po natin. So, yun po yung gagawin nating proseso dyan.
Thank you.
For our next question po from Mayor Riza Pamorada of Alcantara, Romblon, may way po ba para mapabilis ang pagkuha ng RT-PCR results dahil dito po sa Romblon ay 10 to 14 days ang processing?
Again, can I have the question again? We know na nag-choppy ka.
May way po ba para mapabilis ang pagkuha ng RT-PCR results from the specimen na nanggagaling sa Romblon? 10 to 14 days daw po ang processing sa kanila.
Yeah. So, syempre, ang pinaka-way po, ma'am, Mayor, ay magkaroon tayo ng sarili nating RT-PCR testing facility dyan sa Romblon, dyan po sa area nyo, para mas mabilis na po. Ngayon, ito pong test, katulad nga ng sabi ko kanina, kung tungkol po dun sa test, kung aantayin natin ng ganyang katagal, kailangan po ang unang-una nating gagawin, we do immediate isolation. Lalong-lalo na po, sinasabi nyo, ang turnaround time ng test na bumabalik sa inyo is 10 to 14 days. We do not need to wait for the test results para gumawa po tayo ng hakbang para sa mga pasyente. Basta ang isang pasyente may simptomas na po siya, at alam po natin ang kanyang history, even without exposure actually, kasi marami na hong nangyayari ngayon, hindi nila natatandaan na na-expose sila o di kaya meron palang asymptomatic sa kanilang household, kaya hindi natin na-detect. So mas maganda na immediate isolation po. With or without the test, you were able to isolate, you were able to control yung pong possible transmission itong sakit na ito.
From Mayor Lita Aquino of Moncada, Tarlac, kailangan po bang mag-isolate ng 14 days ang second generation kung asymptomatic naman po sila?
Lagi po tayong erring on the side of caution. So halimbawa, pag sinabi niyo hong second generation, for example, ako po yung may sakit, Tapos nakausap ko po kayo. So you are the first generation. Kayo naman po, kinausap nyo yung asawa nyo. Yung asawa nyo ang second generation. So that is how we try to link and try to identify yung generation of exposures and contacts natin. So yung second generation, pinakamaganda na po no na maobserbahang maigi. Kapag walang simptomas, just do the minimum health standards na sinasabi natin, naka-mask siya, naka-physical distancing siya, hindi siya nakikisalamaw muna sa mga tao para lang po maging sigurado tayo. Maganda rin kung mapapatest din natin even the second layer of exposures para masigurado at hindi natin siya malimitahan ng 14 days kasi minsan no second generation naman po siya, wala naman talagang naging direct exposure pero we are asking them to isolate. So kung meron po tayong means to test them, mas maganda pag lumabas na negative, pwede na hong makisalamuha but with the minimum health standards. Pero ang lagi ho nating titignan din kapag ho yung mga second generation, first generation, kailangan alam po natin kung ano po yung definition ng close contact. Minsan ho kasi dumaan lang yung tao sa tabi natin, sinasabi na natin close contact na siya. Hindi po ganon. Kailangan po ang isang tao has direct contact, ang definition natin, has stayed with that person, interacted with that person for a minimum of 15 minutes. Tapos magkalapitan po sila, less than 1 meter po ang pagitan nila. Pwedeng nakamask sila or pwedeng hindi sila naka-PPEs, pero as long as 15 minutes and more naka-interact mo yung tao na nagpositibo, na nagka-simptomas, you are already a close contact. So kailangan po alam din natin yun kasi nga minsan naka-classify natin yung mga tao na hindi naman talaga close contact na dumaan lang dun sa pasyente, kino-consider na ho natin silang close contact. So kailangan din yung definition mai-apply po natin para hindi naman lahat po ay na-identify natin as close contacts.
Thank you po. Next one po is from Mayor Marcel Avestruz of Barugo, Leyte. She shared about their protocol. Sa kanila daw po sa Leyte, they quarantine their LSIs and subjected to RT-PCR test on the 5th or 6th day. If yielded positive, transferred to COVID mild, and if negative, allowed to go home but has to continue home isolation. Any comment daw po on their protocol?
Yeah, I think that is ang komento ko lang po ma'am, baka mas maganda kung makumpleto yung 14 days na isolation, no? So, okay po 'yun na pinapauwi kapag nagne-negative, pero tignan din po natin kung yung kanilang bahay is conducive for home quarantine. Kailangan po kasi sabi nga natin meron tayong mga conditions for home quarantine. So if we let them go home, na nag-negative siya, tapos pinapag-isolate po natin siya ng another how many days because on the 6th day po kayo nagpapatest, kung sakaling magkakasimptoma siya at wala silang talagang adequate rooms no, for their home quarantine, baka magkaroon pa rin ng hawaan. Pero maganda na rin po yung ginagawa nyo. That's right, no? When they go to your area, you quarantine them and then on the 5th to 6th day, no? So, yun pong I assume na kaya ginagawa nyo on the 5th to 6th day ang testing is because of the average time no na nagde-develop ng symptoms kung sakali ang isang tao kapag may COVID. So tama naman po 'yun. Yun lang po, just ensure na kapag pinauwi natin, meron din silang conducive place for them to isolate in their homes.
From Mayor Renato Cabael of Motyong, Samar, is it really safe and secure to transport a COVID-19 positive patient by plane from its point of origin to its final destination? We have this of an OFW tested positive and is going to be transported today to our LG.
Well, as long as proper protocols are followed, we can do that, no? So, halimbawa po, siya ita-transport by plane, kailangan naka-PPE po ang ating mga staff or mga stewardess. Kailangan meron po siyang adequate na distance from the other passengers. Kailangan din po na siya rin ay naka-PPE, no? Yung especially yung may sakit, no? So, kailangan naka-mask siya, kailangan naka-face shield siya, kailangan po pagkatapos niyang mag-disembark, kailangan ma-disinfect na maayos eroplano. So yun naman po ay ginagawa natin because there are really reasons kung bakit natin siya itatransport pabalik sa kanyang probinsya. But of course, ito po ay mga special cases siguro kasi ang atin pong rekomendasyon kung talagang ang tao ay positive, magstay na lang muna po kung saan siya naka-quarantine sa ngayon at tsaka na lang po siya mag-travel after niyang matapos yung isolation niya at siya po ay na-declare na as recovered. Pero as I've said, if there is a special circumstance or case ngayon kung bakit siya po iuwi, and then we just need to enforce yung protocol for the standards for PPEs at saka po yung mga distancing measures and disinfection after.
Another question po from Mayor Coro of Del Carmen, Siargao. He is asking po kung ano ang status or any updates on vaccine development.
Yes, ma'am. No? Good afternoon po, Mayor. No? So ang atin pong development for vaccines, tayo po ay nakikipag-negotiate na sa ngayon. Unang-una, sumali po tayo dun sa WHO Solidarity Trial for Vaccines kung saan ang WHO po ay naghihikayat ng mga bansa na sumali dito where there are a list of vaccines na susubukan at isasama dyan sa clinical trial na yan. So magkakaroon po niyan, nagbigay na tayo ng letter of intent at tayo ay inaccept na ng WHO dito sa solidarity trial na ito. Magbe-benefit po tayo. This is an opportunity for country para dito sa ating bansa, no? Itong ating pagsali diyan kasi makaka-access po tayo nitong bakuna na ito. And also pagkatapos noon, kapag natapos yung trial, we can therefore magkakaroon tayo ng at least position for us to be allocated with these vaccines because alam po natin na internationally magkakaroon na ng competition pagkadating sa bakunang ito. Pangalawa, sumali rin ho tayo, nagkikipag-usap tayo ngayon dito sa COVAX facility na tinatawag. Ito po yung magkakaroon po ng arrangements where pinag-aaralan na ngayon ng ating gobyerno kung saan may prepayment po kasi yan, yung COVAX facility, kung saan pag nag-prepay tayo, we will be apportioned ng at least 20% of our population will be provided with these vaccines. Pinag-aaralan na ho natin yan kasi iba-iba ho ang manufacturers ng vaccine na yan. So ngayon po almost 200 po ang manufacturers all over the world. Pero meron lang ho talagang top, hindi ko mabigay number, parang 9 na talagang sila na yung nasa advanced stages. You have heard of Moderna, yung sa AstraZeneca. Yan po yung mga top ngayon na nasa phase 3 na sila ng clinical trial. And dito po tayo nakikipag-usap sa mga iba't ibang mga institutions abroad para tayo ay makaposisyon. Pangatlo, meron ho tayong 4 na manufacturers that have already signified their intent na makipagtrabaho sa atin sa Pilipinas for their phase 3 ng clinical trial ng kanilang mga bakuna. Ito po ay 3 galing sa China at isa ay galing sa Chinese Taipei. So pinag-aaralan po natin lahat yan and wag po kayo mag-aalala, pumuposisyon po ang Philippine government para magkakaroon po ng bakuna ang ating mga kababayan kapag nagkaroon na po ng developed na vaccine. So that is our update for our vaccine. So we will be updating each one of you maybe in the coming weeks para po kung meron na ho tayo nakapag-final na agreement. But definitely po, yung WHO Solidarity Trial for Vaccines, matutuloy po iyon. Yung iba po, pinag-aaralan pa lang ho ng Philippine government if we are going to finalize our agreement with the other manufacturers also.
Thank you, Usec. That's very reassuring for us po to know na there are developments on this. Next one po from Mayor Frances Petilla of Palo Leyte. She said that they are still testing their recovered asymptomatic positives confined more than 14 days. We are testing before release as this also helps them in their acceptance in the community. Can you please send us materials or documents which state that after 14 days, patient is no longer infectious?
Yes, actually, you can find that, ma'am, sa USCDC. Sa kanila po nanggaling yan. Pagkatapos ng WHO, nagpalabas na rin po ng kanilang rekomendasyon. At ang sinasabi nga, on the 10th day of the illness, as long as you are mild and asymptomatic, no, and you have resolved symptoms already, you are already non-infectious. So, kailangan lang po ng change ng mindset. Hindi po natin pwedeng gamitin ang RT-PCR testing as our basis for tagging people as recovered. Paano naman po yung patuloy na nagpa-positive pa rin kahit 2 buwan na? Even in other countries, meron pong mga experiences abroad where 55 days na, no, 55th day na nila, positive pa rin po sila. That's why we have tried to veer away, no, and redirect our protocol kung saan we would want to we have removed testing as a basis for us to discharge patients. Alam niyo po, isa rin po ito sa nakakabigat sa ating health system kasi yung iba pong pasyente sa ospital, hindi po sila mai-discharge kasi nag-aantay pa rin na mag-negative ang pasyente. And ang katulad nga ng sabi ko, ang RT-PCR po, sasabihin niya sa iyo kung may virus ka o wala. Pero hindi niya po sasabihin sa inyo kung yung virus na yon infectious pa or hindi. Kaya nga po, if you remember, the case of Senator Zubiri, the case of Senator Angara, nag-negative na, nag-positive uli because these are remnants of the virus and the remnants of the virus can easily be detected by RT-PCR machine because they are very sensitive. Kaya nga po, sabi natin, wag na po tayo mag-rely dito sa test para lang makapag-reintegrate back into the community. Kasi burden din po siya sa system because hindi naman po ganun kadami ang kits natin. Hindi rin naman po ganun ka-accessible ang mga laboratories minsan. Minsan it will take you, sabi nga nung ni Mayor sa Romblon, it takes them 2 weeks before their test comes out. So kapag ganyan ang estado natin, yung ating mga pasyente, hindi natin mailabas sa quarantine facility or sa mga ospital or hindi sila makabalik sa komunidad because we base it on test. So, kailangan lang sundin natin yung protocol. Let us change the mindset of our people so that these individuals who are para bang they are worthy, no, of being reintegrated back ay makabalik na po sa komunidad. We will be sending our protocols and different evidences dito po sa ating organizers para po ma-share sa inyong lahat. Hopefully po, iisa lang yung protocol natin, we can all harmonize.
Mm-hmm. Yeah.
From Mayor Orlan Calayag of Dolores, Quezon, how far can we go in terms of disclosing personal information of COVID-19 positive patients? Madami po kasi ang nanghihingi ng mas detailed info pero baka naman po magalit ang patient. Salamat.
Yes, ma'am. Meron ho tayong Republic Act on Notifiable Diseases. Meron din ho tayong batas dito sa ating bansa, yung National Privacy Law. So dito po ang mga pinagbabasihan natin kung paano natin gagawin, especially there is a pandemic or a public health emergency. In the RA for the Notifiable Diseases, it specifically states kailangan because of a public health emergency at para magawa natin ang interventions natin dito sa ating response, we can share this information to our local health officials. Doon lang po. Ang impormasyon po ng pasyente kailangan sa mga health officials lang or local government officials natin sinishare para makagawa ng action. That's the reason why we are sharing. Pero yung pag-share po sa iba pang tao o kaya pinopost minsan ng iba po sa social media and all, that is already a violation of the National Privacy Law. So hindi po yun pwede. So what information can we provide? We can provide po ang mga pangalan po, pinoprovide po yan ng DOH sa ating mga local government officials. Binibigay ho namin sa inyo dahil para po makontact trace kayo, makapag-manage po kayo ng mga individuals sa community. Pero hindi na ho dapat i-share pa pagkatapos nun. Kung gusto ho natin mag-share, pwede naman hong mag-inform sa community na may pasyente tayo or may nag-positive dito. Siya po ay pumunta sa palengke, yung mga ganong circumstances. Pero yung mga personal po na kailangan sinabi pa yung pangalan, sinabi pa ho yung kanilang edad, sinabi pa ho yung nagtatrabaho sa ganito, maaari pong kung hindi naman talaga kailangan, hindi na po dapat i-share. So we can only share among officials para ho sa interventions. Pero other than that, we are not allowed to share because this is personal information and the person has the right to confidentiality.
From Mayor Rex Tanwatco of Tanay, Rizal. Good afternoon, Usec. Meron po ba kayong idea kung magkano ang pagpapagawa ng PCR laboratory?
Naku, tatanungin natin si Kin. Kin, magkano ba inabot ang San Miguel? I really do not have any idea, Mayor, no? But of course, we have a list of the different uh, equipments and the space requirements for a laboratory. Pwede ho namin i-share yun dito. Pero yung estimate po, hindi ko ho alam. I don't know. Kin, can you give them an estimate?
Well, I guess the most basic, sa amin medyo very equipped kami because I guess we also have the budget for it. But I guess essentially po doon a PCR machine. When we bought it, it was about 1 point something. Now I think it's about 800. A Natch machine was about 2.4 when we bought it. I think now it's 1 point something. But then apart from that, may maraming mga kailangan biosecurity, autoclave. So I don't know. And then you would have to physically build it, have the negative pressure rooms as well. Yung sa physical, like sa Red Cross, they came to us for help sa Katiklan. Physical structure lang, maybe sa mga three or four. Equipment, maybe another 4 or 5, depending on what kind of equipment. So it's not cheap, but I think necessary. So if more people are able to put up labs and it's encouraging po to me because since we put up our lab, maraming mga private companies who have been on the phone to us asking kung how we did it, how we got DOH also to help. And we always refer them to your team because, ma'am, if you remember, we put it together, I think in about 2 months, no? And it was really because DOH was there holding our hand throughout and even RITM. And yeah, we learned so much to put it up. So if anyone wants to ask for help, please reach out to us. Not for the money, just for the knowledge, and that already in itself is a huge thing. But sorry, we know now. Could I just use this and to say it in the siguro in the spirit? Because I mean, I typed it for here, but I want to say it in this spirit, Bono. Ma'am, I paid really close attention to your presentation, and I've seen the strategy of the government. I appreciate the strategy of the government. I'm glad that you have this systems kind of thinking approach and a whole of nation approach to solving COVID. But ma'am, sa totoo lang po, iba talaga yung reality on the ground. And I know firsthand because our company is testing in a very big way. We support government's call to test. Nandun talaga si Mr. Ang. But then what we're finding out is it is so messy. I don't know if anyone here is from Cavite, but San Miguel has many plants there, and we've been testing all our employees. But the way it's turning out is it's not welcome in the barangays and in the municipalities. They see it siguro more as a challenge than as a help, and we're also finding it very hard to place our employees who turn out positive. So siguro po, what I'm trying to say is if a company as large as San Miguel and is well connected, and I can text you po, I can text Sir Vince, I can text Sec Charlie, someone as big as us na we have this link to you, nahihirapan. Medyo natatakot ako for other smaller companies who aren't able to access this kind of help from the national government. So it's all very neat and it all makes sense, pero sobrang kulang talaga yung the quarantine facilities, even things like just moving patients. It's so hard. We have friends in the AFP that we constantly reach out to, but not everyone has the network of San Miguel. And that's where I am really worried.
Yes, thank you, King, no? If I may respond, no? So, alam mo, kami rin po may ganong realization, no? That's why, nung nung bumababa na tayo, no? We started off, no, Secretary Duque with Secretary Galvez and the other cabinet members, gang visiting places. Isa yan sa talagang parang recognizable na challenge, no, pagdating sa baba, no, that ang daming kulang, ang daming gap, ang daming kailangang ipatupad na ayos, no. So in the coming days, yung ating naisipan, ano, na kailangan talagang gawin, we have to strengthen our local government. We have to be capacitated. Hindi pwedeng, for example, ang isang local government, mag-aantay pa sila ng tulong galing sa national para ma-mobilize nila yung nilang mga pasyente and all. But if we capacitate them, if they would have this kind of network within their locality, mas mabilis, no? And if there would be interlocal government network. So, ito yung gusto naming buuin sa ngayon, no? Actually, there are health zones before that are being used, these interlocal health zones, kung saan isang grupo yan ng LGUs, nagkakaroon ng MOA, meron silang hospital na common na referral para sa kanilang lahat, meron silang mga facilities na nakalink sa bawat isa. Also, they do procurement, no? Pulled yan among these LGUs, interlocal health zones. If we can only use that model for local governments to help each other, no? Especially when it comes to treatment, no? Dito tayo minsan nagkakaroon din ng issue, no? Sabi mo nga, kung ang ibang LGU, kung wala talagang ka-network, hindi sila makahanap ng facility for their residents, no? So ito ang dapat natin magkaroon ng capacity ang ating LGUs for that. So hopefully with all of these things that we are going to do with this code strategy, with these 5 components that are being integrated, matutugunan natin itong gaps na ito. So isa yan, no, Kin, and with all of our local government officials here, na-observe po namin yan, no, yung mga challenges natin across different LGUs, mga gaps natin sa mga LGUs na gusto po naming punan. That's why we are really going down and we are trying to identify areas, no, down to the barangay level kung saan kami dapat tumulong at mapagtuunan ng pansin. Pero sana ang local governments din po, immobilize niyo po yung mga kasama natin sa inyong localities, katulad po ng mga people's organizations, civil societies, NGOs, gustong-gusto po nilang tumulong, no? At kung makakatulong sila, and then mas malaking bahagi po ito ng pwede nating gawin dyan sa inyong locality.
Mm-hmm. Yeah.
Thank you, Usec, and thank you din po, Ms. Kin, for echoing the concerns of our mayors. Moving forward, we have a question from Mayor Jasmine Bautista of Magallanes, Cavite. What will be the plan of DOH for the next 3 months?
Winona, again, parang choppy-choppy uli. Sorry.
Yung question po, what will be the plan of DOH in the next 3 months?
In the next 3 months. Okay. So, ang plano ng ating kagawaran, it's not just DOH, but it's the whole of government, no? That what we plan for, ito na nga, we strengthen the roles of local governments. It should really be local governments leading, no? This fight against COVID-19, where national government provides that support. So hopefully, ito pong ginagawa natin sa code na strategy, ito po yung 2 weeks natin gagawin. This is to prime the system. No, we are not saying we're going to get to go to all of these barangays that we have identified. We are hoping that the local governments would follow suit, no, dito po sa ginagawa natin ng mga modelo ng mga iba't ibang barangay. Nakikita po natin na we cannot remain to be in quarantine forever. Alam po natin the virus is here, it's going to stay with us for long until we can have that vaccine. So, tinitignan ho natin na mag-i-ease uli yung restrictions na yan kapag na-control or na-manage na ho natin itong medyo pagtaas ng kaso sa ngayon. And we are looking at granular lockdowns where LGUs will really have that authority and would really have that strengthened capacity to do localized lockdown. So we don't need to close the whole city, the whole municipality, or even the whole region. We just need to close down, yun lang kung identified na may clusters doon sa specific area sa locality. So this is what we would like to see in the next 3 months. No? And of course, we'd like to see our health system have this kind of capacity, more capacity for the health system, more laboratories. Sabi ko kanina nga, may 74 tayo awaiting for licensing. Hopefully, in the next 2 months, we will be able to license them. Hopefully also, we will have equitable distribution of these labs. Pag tinignan natin across regions, most of the laboratories are in NCR and karatig na mga regions like 4A, Region 3. Pero pag tinignan ho natin sa Visayas and Mindanao, kakaunti pa lang, less than 20 lang for Visayas, less than 20 in Mindanao. So we are now redirecting our focus to Visayas and Mindanao na we are helping them na mas dumami pa ang laboratories doon para yung access ng tao. Second, gusto rin natin makakita pa rin ng additional quarantine facilities. So ito na po yung pinagtatrabahuhan pang ngayon ng DPWH, yung Secretary Villar, kung saan meron na ho silang mga ina-identify na mga areas where they can build more quarantine facilities for the country. Third, our hospitals. Expanding our hospitals. Meron na ho tayong patapos sa East Avenue where there is a separate building na ide-dedicate po for COVID. Meron na ho tayo sa Quirino Memorial Medical Center na matatapos na rin. I think it's 90% completed already. Nagagawin din po dedicated for COVID. Meron din po tayo na mga wings na dinadagdag like in Lung Center of the Philippines na dinadagdagan po ng mga kwarto para maging isolation rooms. Gusto nating makita yung mga efforts na ito na mangyari rin sa ibang regions. It is not just the National Capital Region that is affected by this virus. It is all over the country. So hopefully, when we try to capacitate our health system here in the National Capital Region, we can also mirror and also do this kind of initiatives in the other regions of the country, that all regions of the country will be prepared if and when this continues on and lahat po ng ating mga kababayan ay mabibigyan ng tamang serbisyo sa dadating na mga 3 buwan.
Thank you, Usec. We understand na busy po ang schedule nyo, kaya we will be accommodating only 3 more questions. And I think sa mga naiwan po, baka we can direct your questions through Usec's email and mag-response na lang po kami through email as well. Next one from Mayor Hermie Velasco of San Gabriel, La Union. Usec, sa slides po ng hospital and HRH capacity natin as of August 6, maluwag-luwag po availability ng beds and facilities. Sa provinces po, ano po ba ang picture ng distribution nitong mga HRH and equipment?
Well, kapag tinignan ho natin, sabi ko nga po, this is the country's health system capacity. Pag tinignan natin, ang buong Pilipinas, nasa danger zone tayo at 54%. But if we look at the disaggregation of this capacity that we have, makikita po natin specific tayo sa 3 areas in the country. In the National Capital Region po, katulad po ng ating meron tayo for these past weeks na tumataas talaga yung ating health system na critical care utilization. For the National Capital Region, meron po tayong almost 86% occupied ng ating mga ward beds na tinatawag. Ang ating isolation beds po is almost 70+% occupied. ICU beds is the same, about 72% occupied. So that's National Capital Region. Doon naman po sa ating Region 4A, ang Region 4A po natin ngayon, 67% occupied po sa critical care utilization. Ang kanilang ward beds, about 60% for isolation beds, and ang kanilang ICU beds po, 67% din ang occupancy. So nasa danger zone po ang Region 4A. And ang Region 7 naman po, napakaganda ng nangyari sa Region 7. Matatandaan niyo po about a month ago, nagkaroon po ng parang overwhelmed ang system ng Region 7. Pero sa ngayon po, makikita natin, nandun na po siya, bumaba na po siya below 50% ang occupancy ng kanyang ward beds, isolation beds, at saka ICU beds. So maganda po yung nagawa nating response sa Region 7, kaya atin pong ina-adapt din whatever we were able to do that before. So for Ilocos region naman po, meron po tayong occupancy for ICU beds sa Ilocos region is 41.8%. Para naman po sa ating isolation beds, 39.6%. And para naman po sa bed wards, it's 34.16%. So nandun pa rin ang Ilocos region dun sa acceptable levels po. Although yun pong ating occupancy for ICU beds, medyo nasa 41%, it's a little lower than 50%, but we still need to monitor and kailangan po masiguro lang natin na hindi pa tataas.
Second to the last question po from Mayor Crisel Lagman of Tabaco Albay. Tuloy ang population and housing census ng PSA this September 1 to 28. Is this safe to do at this time for both enumerators and household members? May susundin po bang preparation for our enumerators?
Kung itutuloy po nila yan, ma'am, pareho pa rin naman, minimum health standards pa rin ang ating ipatutupad. So kung paano po tayo nagbabahay-bahay sa mga ginagawa natin for this response for COVID, ganun din po siguro dapat ang gawin ng ating mga enumerators ng PSA. Kailangan naka-PPE sila, kailangan din may physical distancing sila. All of these minimum health standards has to be enforced so that we can assure na walang impeksyon na mangyayari. So ito po ay desisyon ng Philippine Statistics Authority under NEDA. So kung pinayagan po sila na mangyari yan, we just need to enforce the minimum health standards. And hopefully, local governments also can provide that guidance and support dito po sa PSA teams na bababa para po hindi naman tayo magkaroon ng source of infection because of this enumeration.
Alright, and last question po from Mayor Hermie Velasco. Ano po ang contingency plans natin? Huwag naman po sana mangyari na dumami ang cases in the coming months. Will there be any augmentation of HRH plans?
Yes, Mayor, meron na po tayong ginagawa ngayon ng augmentation. Actually, Manila or Metro Manila ay nanghingi na tayo ng tulong sa iba't ibang rehiyon. At nakakuha naman po tayo. I think there were about 76 healthcare workers who have heeded the call coming from Visayas at parating na po sila ngayong Lunes dito sa Metro Manila. Sa Mindanao naman po, I think there's 28 na mga doktor din na talagang pupunta rin po sila dito sa Metro Manila para tulungan ang ating mga ospital. Aside from that, the contingency plan, of course, ito pa rin atin pong interregional na networks natin. Kung sakaling napupuno po ang isang rehiyon, yung mga karatig na region, kailangan makatulong. Katulad po ng nangyayari ngayon sa National Capital Region, kapag wala ho kaming mabigyan ng admitan sa isang pasyente for hospitals, beds na ganyan, nagdadala na po kami ng pasyente sa Region 3. Nakakatulong na po sa atin ngayon ang Region 3, ang Jose Bilingad Hospital at iba pang malalaking ospital dyan sa Region 3 ay nagagamit na rin po natin kapag wala po tayong mabigyan o paglagyan ng pasyente sa ngayon. Contingency plan also would include our strategies that we are now doing. So kailangan strengthened ang pag-enforce ng protocols. We have observed that a portion of those admitted in our hospitals right now are mild and asymptomatic patients in the National Capital Region. So ngayon, pinag-iigting natin ang protocol na hindi na pwedeng i-admit sa ating mga ospital ang mga mild and asymptomatic. They have to be referred to a temporary treatment and monitoring facility so that we do not congest our hospitals. So nung inanalyze po namin yan, hindi naman pala lahat severe and critical na nasa ospital. Mas marami pa ho yung mild and asymptomatic. So kailangan lang ho nating iayos ang protocol, i-redirect natin kung saan talagang facility dapat pupunta ang isang individual. Kaya nga po tayo may one hospital command para po hindi nawawala ang ating mga pasyente kung saan dapat sila pumunta at ang mga ospital din natin para ma-enforce natin yung protocol na kailangan natin para hindi po tayo umaabot sa ganitong congestion ng ospital sa mga susunod na panahon.
Alright, thank you very much po, Usec Vergeire, and to all our Mayor Fellows who sent in their questions. Pasensya na po sa mga hindi namin nabasa, but we will try our best na ipanayin po kay Usec lahat ng questions nito. Before we say goodbye po to Usec Vergeire, dahil baka may press con pa po kayo mamaya, can we please request for everyone to turn on their camera for the photo op? So, on lang po ng cameras. Alright, ready po? 1, 2, 3. Another one po. 1, 2, 3. Alright. And that concludes our webinar for today. Before we end, Usec, would you like to share a few words po?
Yeah, I'd just like to thank all of you, no, especially San Miguel Corporation, Kin, thank you very much. Si Harvey Ke, kanina nagbigay ng message also, maraming salamat. I also like to thank all of our local government officials, no, na nandito ang ating mga mayors. I like to recognize yun pong mga efforts nyo, yung mga initiatives nyo. Alam nyo po, nung nag-uumpisa pa lang ang pandemya, lagi ko hong sinasabi na hangang-hanga ako sa local government officials natin, especially our mayors, our governors. Makikita mo kung gaano nila gustong-gustong alagaan ang kanilang mga kababayan. Yun na lang mga ayaw nilang magpapasok kasi mai-infection ng community nila. Pag tinignan mo, it's because they care so much for their constituents in their locality. At ako po ay humahanga sa inyo sa ganyang paraan. No? I like to recognize po lahat ng ginagawa nyo. Alam ko po pagod na rin po kayo dahil nung umpisa pa lang talaga nagre-respond na tayo. Sana po sama-sama pa rin tayo. Ituloy natin itong laban na ito. Malaki po ang parte nyo dito sa ating response na ito. As we say, kayo po ang aming inaasahan to lead this implementation for us to be able to be successful in this response. Lagi lang ho tayong magtulong-tulungan, magsabi lang ho kayo sa amin kung meron ho kayong pangangailangan para matugunan ho natin hanggat sa kakayanin ng national government. At lagi niyo pong iisipin, nasa likod niyo po kami. We support all of you. We thank all of you for all of your efforts. Sana lang po maipatupad natin ng maayos ang protocol. Sana rin po ma-harmonize din po at magkaroon tayo ng common na pagpapatupad ng lahat ng protocols para po maging successful ang ating response. Again, I'd like to thank our organizers. Kin, thank you very much. Winona, thank you. And I'd like to also remind everybody, ngayon pong tumataas ang mga kaso dito sa ating bansa, patuloy po nating ipatupad ang ating mga protocol na mga minimum health requirements. Lagi po nating i-remind ang ating mga kasama dyan sa locality natin na kailangan lang po tayo na ang maging bida solusyon, no? So yung bida solusyon, alam na po natin kung ano ang kailangan nating gawin. Kailangan lang ho, meron lang hong responsibilidad ang bawat isa sa atin na isa sa isip natin, isa sa puso, para lang po natin makaagapay na tayo dito po sa ating sitwasyon na meron tayo ngayon. So mag-iingat po tayo lahat. And again, mabuhay po kayong lahat. Maraming salamat.
Maraming salamat po, Usec Vergeire. This has been a very enlightening and fruitful discussion. We'll see you po sa inyong mga press con. Papanoorin po namin kayo on TV. And lagi po nang gaya namin sinasabi na basta sama-sama ay kakayanin natin. Again, maraming salamat po sa inyo.